Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world. From border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome today. This is your correspondent, Jim Tate, and thank you for tuning into the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. I'm really pleased today to have my guest, Jolie Ritzo, Vice President of Strategy and Network Engagement for the Civitas Networks for Health organization. They are a national collaborative comprised of member organizations working to use health information exchange, health data, and multi-stakeholder cross-sector approaches to improving health. Jolie, thanks for joining the Tate Chronicles.
Thank you so much for having me. It's a pleasure.
It's really timely that we're talking today because as I speak with you, we're just a few weeks away from the annual Civitas conference, August 20th through 23rd. So it'd be interesting to kind of dive into some what you may think some of the themes of that will be. But first, let me just ask you an overarching question. What is the mission of Civitas?
Yeah, absolutely. Civitas, we are both a mission-driven and membership organization. Our charge is really to both bring together our members from across the national network to provide opportunities for collaboration, education, problem solving, and certainly to support these community-governed, data-led nonprofit entities so that they're not starting work from scratch and rather to continue to kind of illuminate what is working and what is not working. But we also make sure that we're spending time with our federal partners and other national partners to create a bidirectional exchange of information. We believe strongly that there's a lot to be learned region to region, and certainly as we dive into communities and sort of elevate the voices of those who are working locally so that those who are implementing programs and regulation and sort of legislating on our behalf understand how it's playing out, again, in communities throughout the country. So that bidirectional exchange is also critical to our mission, and really with the sort of vision of seeing communities thrive as we continue to improve health broadly and also further interoperability.
You know, one thing that kind of brings up for me, Jolie, is the concept that at a national level there are standards and requirements around the exchange and interoperability of healthcare data, but how that healthcare data can really be used to promote equity, social determinants of health, those kind of things. That information often exists at a community or much more of a regional level than at a national level. So it sounds like your organization does a lot of work in that regard.
Absolutely. We're very much committed to that. And the reason I think, again, that we believe so strongly in these local efforts is that community governance is really critical to having both kind of the ability to collect data, to exchange data, and then to use that data in meaningful ways. And when I say community governance, that's really having a very inclusive community table that has, multiple stakeholders, payers, providers, purchasers, patients, public health, community-based organizations, and those that are going to potentially benefit from solutions that may be implemented as a result of having better data to understand what is the community need.
Now, what types, kind of specifically, organizations make up your membership?
Sure. So Civitas right now has over 165 members across the country. We have members in every state. And we have 3 levels of membership. we have our full members, our affiliate members, and our strategic business and technology members. The full members, the requirement or the criteria is that they are nonprofit, they are community governed, and they're data led. So those are often health information exchanges, all payer claims databases, what we refer to as regional health improvement collaboratives, many of the recognized quality improvement organizations. So that makes up the full member category. And then we have our affiliate category, which affiliates may or may not be nonprofit organizations. They may or may not have that community governance structure, but they are very definitely aligned with the mission of Civitas and the work of our members. Our affiliate category is increasingly other national networks. So we have HIMSS, we have the American Academy of Family Physicians, Direct Trust, Academy Health, the National Association of Health Data Organizations, sure. Among many others. And that's just an example. Again, there's about, close to 20 affiliate members. And then the strategic business and technology members are a really critical part of our thriving network that we're building. And these are often the technology providers. They might be supporting our full members with, interoperability solutions. They could be providing other sort of technical services to support the technical assistance that our members are providing, but they're sort of furthering the excellence of the full members. So that's a little bit about the members themselves. Sure. They are often a step or two removed from the actual delivery of care, but again, are working pretty tirelessly to improve health.
How does the communication take place among your membership? How is there an exchange of best practices? I know we've got the big annual conference coming up in August, but other than that, what type of communication, takes place and idea exchange?
Yeah, that's great. And thank you for mentioning the annual conference. I feel like it is kind of the culmination of all the things we do throughout the year. Our community absolutely loves the opportunity to come together. There are strong relationships, and there's just so many opportunities to learn, to network, to connect. But we do that throughout the year. We have a few different ways that we do that. So we offer various virtual events for our members. We have what we call Network News, which is our all-member monthly meeting, which is, again, pretty informational, but a great way to make sure everyone's sort of staying apprised to the happenings across the network. We do public policy briefings for our members quarterly, where our government relations team does a very tailored report out on federal legislation and regulations that we should be staying sort of attuned to. And then we have what we call member roundtables. The roundtables are very different than, say, a network news, where it's less didactic presentation and more focused on problem solving, working together, connecting, asking questions, being in meaningful discussion. And beyond our structured virtual events, we host about 8 different work groups, and we also have councils. The work groups, I would say, increasingly are where our members are, again, engaging, meeting other participants in the network, aligning around topics of interest or key areas of focus. Beyond that, we have many other communication channels. So we have a national newsletter that reaches about 2,500 recipients. It uses machine learning. We do feed it content, but it also draws on our members' RSS feeds and other publications that we think are relevant. And what's really cool is that tool, it produces a newsletter that is, again, dishing up content that's relevant to the person that's receiving it, and they can determine whether they want it daily, weekly, or monthly. And we have pretty amazing open and click-through rates, but we also have social media channels on Twitter and LinkedIn. We are getting ready to launch a new blog, which we're excited about. So we do a lot of communicating both with our members and our industry partners. And I haven't even talked about partnerships, but that's a whole other sort of strategy we have to increase kind of collective impact and making sure that we're also working through our partners' communication channels as well.
One thing I'm very interested in, I was looking at your website, and I ran across something called the Health Data Utility, HDU.
Yes.
What is that? Looks like a pretty significant tool that's provided.
Absolutely. So we did, in partnership with the Maryland Healthcare Commission, over this past year, we had an effort to both produce an in-depth issue brief on health data utilities as well as the health data utility framework. The framework is meant to be a very sort of action-oriented guide to implementation. Health data utilities are built on collaborative leadership, technical capabilities. They are very much sort of using both sort of increased privacy and security, but most importantly, I think it's building off of the infrastructure from health information exchanges, but really it's about the expanded use cases. So going beyond just clinical data exchange to public health, social determinants of health, having specific Medicaid use cases, and really thinking again about having that increased or more robust data to do sort of whole person care, and have the ability to sort of better coordinate care and so on. So that's really the health data utility is. We like to say models rather than just a model because we recognize the variance state to state, region to region. And we also believe that, in some cases it may be one entity, but in many cases it's likely going to be multiple entities working together.
One thing I continue to be curious about, Jolie, is the whole concept of interoperability and data. And we're getting closer and closer to increased interoperability. There's no doubt about that. The certification requirements, the regulations around information blocking, those kind of things. So all that data is beginning to flow, but so technology is not the barrier, or it doesn't seem like it's going to be the barrier to equity and really healthcare deliveries. What are some of the barriers? Is it workflows? Is it understanding what to do with the data? Is it best practices? What do you think?
Yeah, I think that, yes, that's, I think, just a incredibly important point, which is that it's often not the technology. I think because we focus a lot on community governance and the importance of sort of neutral convening and having multiple stakeholders engaged, we know that to move data, you do have to have trust, and that takes time. That you have to be very intentional about building relationships and partnerships. So I think that can be a barrier if you don't have trust. And then, there still are things that make it challenging around, data use agreements and, just navigating various sort of regulations, state to state, within various local jurisdictions. And that does certainly present a barrier. I think that is actually really important, both when thinking about sort of health data utilities, but thinking, more broadly about the work of Civitas members, is just, recognizing how their expertise in navigating those state and local regulations. It's something they've been doing for many, many years. And it is really important aspect to what's going to help the data to flow. And I think, when we think about centralized national networks with sort of, TEFCA, we think that there's still very much a place for these nonprofit, community governed, data-led entities to be very supportive and aligned with those efforts.
Let me say to our listeners right now, if you just joined this episode of the Tate Chronicles, I'm Jim Tate, and I'm speaking with Jolie Ritzo of Civitas for Health. Let's go to history class for a minute, if you don't mind, Jolie. So the very early attempts of exchange of data, I guess, were the perhaps the regional health information organizations, RIOs, and there could be one or numerous ones in a state. They could be more than one in a city. It all depended. And then we had the HIEs, Health Information Exchanges, and then we're moving forward towards more of a, lack of a better word, a national network of networks, TEFCA. And that may be the final or the next big step in terms of data exchange structure. But what was learned from those regional extension? The RIOs, the regional health information organizations, and the health information exchanges. The knowledge gained there, and those the importance of that certainly is not going to go away with TEFCA or any other really nationally top-down imposed interoperability structure. Hope that wasn't too confusing, but the need for that community-based interaction seems as timely now as it has ever been.
Yeah, no, I completely agree with that. And I think, it goes back to, as far as 2009, when we sort of saw the investments in high tech and then looking sort of over the past, 10 or more years in sort of what was deemed the high tech era, it allowed for health information exchanges, across many of our states to both sort of be established and then to start to build out the infrastructure. I think, now we're at a point where, again, we've seen sort of the evolution of health information exchange, and we see these emerging health data utilities. And a big part of that is because of the infrastructure that was put in place and the key learnings of sort of the inception of the health information exchanges. And there was a lot to be learned from this sort of EHR implementation and expansion, and then being able to move clinical data. As a result, that's kind of proof of concept that we can also move other health data. So having that reusable technology is allowing, again, for the expanded use cases that are really critically important as we start to want to truly do something about advancing health equity and addressing unmet health-related social needs in communities, and understanding that much of that happens sort of, as we refer to as, in the other 80 outside of the clinical walls. So I think, it's a combination of having both the technical capability and infrastructure, but it's also, it took a lot of time to navigate state, legislation and regulation, and making sure that, patients' privacy and security were going to be sort of, taken very well care of. The data use agreements, which I already referenced, all of that also critically important. And then having the trust of the communities that they're serving. So, that is something where there, I think, are deep lessons learned, and it really should not be overlooked, because, things like privacy, security, consent management, patients increasingly wanting access to their data, but knowing that their data is secure, is not to be overlooked.
I'm glad you brought that up, the whole issue of the importance of trust. And you kind of mentioned maybe not only trust from the patient level, but from organization to organization and provider to provider. Can you give a little more detail about how you define trust in this arena?
Yeah, I mean, I think, I don't know that I'm necessarily going to define trust, but I would say that this idea of neutral convening and bringing sort of divergent perspectives closer together to understand sort of the value proposition or what's in it for them really does help. And our members are expert at doing just that, at sort of understanding both kind of what is the barrier to either sort of a willingness to share data or other barriers that may be coming up, and then looking at, again, if you looked at it with this lens, does that sort of change the way you're thinking about this, and being able to, again, bring forward different perspectives to help broaden the understanding and sort of move in the direction of, let's think about this more holistically from the sort of community perspective, and remember kind of why we're doing this to begin with.
Well, that concept you're talking about, Jolie, of really communication among folks and entities, that as that communication takes place, that builds trust in itself. That people are aware of what other folks are doing and can discuss the challenges. We've got a lot of challenges, and we have some that are very specific to the U.S. We do not have a national patient identifier. So there have been entities that have arisen to try and work through that to make sure that this patient we're looking at, or the data that we're looking at, really belongs to the patient we want it to come from, or that it applies to. So there definitely has to be work around that. So that is trusted. And just the quality of the data itself, that you're not only getting maybe a little sliver of the data, but some workflows in place that make sure that really all relevant data is being not only exchanged, but delivered to the provider, or those entities that are doing research for those social determinants of health or health equity. So there's got to be trust around those for sure.
Yeah, absolutely. That I think so. And the other thing that is a really important component of sort of trust building as well is transparent decision making. Having sort of beyond doing sort of like having sort of that corporate governance, having advisories, having insights into both sort of how data is being exchanged, how it might be being used. I think that's all, important. And then we also, you mentioned the need for standards. I mean, having clear standards and use of standards in place will continue to increase trust. Having quality data that you can rely on also increases the trust. I mean, when you think about having sort of the patient identifier, that is so critical, particularly when it comes to things like attribution and thinking about how that may then impact payment. And obviously, if you can't rely on that data being quality, well, then that impacts, how providers and health systems are being paid. I mean, so there are implications, and you could quickly lose trust if that wasn't done well. And I think, in certain cases where data is being aggregated for either public reporting or for research, again, you have to know that you can rely on that, because at the point that you're putting out public reports, again, you want to make sure that you can use that in a way that's going to effectively move your community rather than creating sort of bruised reputations and hard feelings.
Well, one thing we've certainly learned about electronic health record systems over the last decade or two is that they are extremely precise, but precision is not enough. There really has to be data that is trusted and is actionable. Again, not only for direct patient care, but for the benefits of data analysis and figuring out what zip codes are most at risk for some particular type of health challenge, and how to identify and push resources to those zip codes or other social determinants.
Absolutely. Yeah. I think, you mentioned an important point, which is that, it's not sufficient just to, again, have the clinical data. That, we're at a point where we need to have that demographic overlay, so that you can, potentially do things like hotspotting. I mean, we saw many of our members doing that during the pandemic. They were sort of ready partners to public health, and because they, again, had those capabilities, and were able to pretty quickly provide that information, which became life-saving in the sense that it helped, states and localities quickly figure out how to resource, how to prioritize, to, flag when there were available beds or not. where, certain communities needed more either information or, again, resources, whether that was, there was, I feel like, at that time it was PPE, it was, it was various masks, it was tests, it was, and that wasn't all that long ago. And it is critically important to have that level of information.
Well, absolutely. And I'm glad you brought that up. We're almost out of time, but I want to underscore what you just said there, because the ability to have access to that data and know what groups were at most risk and which groups really the vaccinations need to be targeted by geographically, age, whatever demographic might be involved, as well as in the early days of the pandemic, nobody knew what types of treatment were needed. So the ability of different organizations to communicate really treatment protocols could only be done almost at a peer-to-peer level.
That's so important. And one of the things I just wanted to quickly highlight. So,
sure.
We keep talking about, having this data and how important that is. And I want to just acknowledge the vision of Civitas when we decided to bring the Strategic Health Information Exchange Collaborative and the Network for Regional Healthcare Improvement together, these two leading national networks. The goal was, again, to have health information exchanges and those that were moving data closer to those who are taking that data and really turning it into meaningful action. And so we talk a lot at Civitas about sort of data and doing. And that's really one of the things when we sort of dig into the theme at the conference this year around public-private partnerships that inspire health transformation. It's going to be a tremendous showcase of just that. When health information exchanges work with their regional health improvement collaboratives or their quality improvement organizations, what does that mean for quality improvement or the cost of care or advancing health equity? Because again, the more sort of robust the data, the more sort of likely that then that data turns into action and we can actually do something about it. So we're seeing some really interesting work play out, and I'm very excited to be able to, again, showcase that over the 3 days of the conference.
How can our listeners find out more about not only your mission and the work at Civitas, as well as the upcoming annual conference? Where can they get that information?
So go civitasforhealth.org. Our website is a wealth of information. And then from that, we would encourage you to reach out to us at Civitas if you have additional questions. But we have, resources available around health data utilities. We have all kinds of information about the conference itself on the conference page. We also share about other events. You can follow us again on social media, both on Twitter and LinkedIn. And those are probably pretty great ways to stay engaged. And you can also subscribe to the national newsletter. You don't have to be a Civitas member to get the newsletter.
That's great. And let me underscore that. Civitas, Civitas, civitasforhealth.org. Well, to our audience, thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Jolie Ritzo of Civitas for Health. Jolie, thanks for coming aboard today.
Thank you so much for having me. It's really been a wonderful conversation.
You can find more information on this show's program page at healthcarenowradio.com. That's healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.